I'm Dr. Sandra Laura Kramers, and I would like to talk to you today about dry eyes. Many of my patients come in complaining of foreign body sensation, burning, itching, redness, chronic tearing, and I want to just go through how we treat that here. So this is something I created called the step ladder approach. These are all the treatments in the world of dry eye, but we like to start with the least difficult, least invasive, least expensive. And the first step is a must. It's called the lid hygiene routine, and I use this whenever I feel my eyes. You should never feel your eyes. If you blink and you feel your eyes, you should do this. The first thing you do is wash your face with hot water as hot as you can stand it without burning the skin, morning and night at least. Then take a warm compress as hot as you can stand it without burning the skin, ideally 2 to 5 minutes morning and night, changing when it gets cold. That heat opens the gland at the base of the eyelash, which produces the fatty lipid part of the tear, which prevents the tear from evaporation. And that's a very important part of making the tear more stable so it doesn't evaporate too quickly. That's step number 2. Step number 3 is using a foam called OcuSoft every day, or diluted baby shampoo. You can do this in the shower. Just keep the eyelids clean. Just keep the bacteria and other critters like Demodex that like to get into our eyelashes away from the eyes. Step number 4 is something I love called Clearadex. I don't have any stock in any of these companies, but I use this. It's about $40 here. It's about $43 on Amazon. They don't have it on CVS yet. And I basically will cut it in half, put it in a Ziploc bag so it lasts a little longer. After I've done the hot compress, the gland is open, and I take some of this tea tree oil, originally from Australia, close my eyes, scrub at the base of the eyelashes, leave it on for 1 minute, wash it off before I open my eyes. The first time I did it, it burned like the dickens. Data shows that the more bacteria you have in your eyelashes, the more it burns. So initially, if it burns a lot, you can dilute it in a little bit of water and then clean, leave the same thing on until you can tolerate full strength for 1 minute. Okay, then you can do this every day for 2 weeks, then every other day for 2 weeks, and then you'll see as you need it. When you feel your eyes burning, foreign body sensation, you feel a sty coming on, you start using this tea tree oil over the counter, and the warm compresses are a must. That's the most important part of this whole treatment regimen. I tell patients if they're not doing the warm compresses, then the chance of these other things helping are much less. So it's very important to do every day. Step number 6, I should say, is an ointment we'll give. Depending on how bad your symptoms are, we'll either give you erythromycin, bacitracin, or Tobradex. Tobradex has a little bit of steroid in it, so if you're going to use it long term, we'll check your pressure in a few weeks, and that kind of helps melt away the secretions and the clogged glands. And then sometimes I'll give something called azazite, which is a drop that is thought to increase the meibomian gland production of oil. And so some patients benefit from that. The studies are still not clear on that one, so I do mention this in my sheet in some patients that want to give it a try. The second step is diet. It's very important to have a high omega-3 diet because that is actually excreted through the glands, and that helps the tear film stabilize. 2,000 to 4,000 milligrams of omega-3 a day is what I recommend. And I tell patients to read section number 2 because it goes through other suggestions such as going gluten-free for 2 months, although we can't say you have to do it. There's some suggestions that it helps in certain patients. There's a great book called Grain Brain that I recommend all my patients read to understand some of the research being done in this area. Step number 3 is using an artificial tear until your tear film is stabilized. Some patients are on this for the rest of their lives. Some patients can use it in the short term and use as a tool that they take out of their toolbox from time to time. If it has no preservative, you can use it every hour as needed. If it has a preservative, no more than 4 times a day because it can actually cause toxicity to the cornea, the preservative. I recommend all drops in the refrigerator because cold also decreases inflammation and itching. If you have itching, you put everything in the refrigerator, but we still use the heat for the meibomian gland and the cold to stabilize the mast cells, which cause itching. If this doesn't help, you let us know, and then we start pulling out the other tools in the toolbox, such as something called doxycycline. I use it at 20 milligrams a day, and you can take it with food because it's actually being used as an anti-inflammatory and not as an antibiotic, and it's used once a day. We still recommend trying to avoid the sun so you don't get a sunburn with the doxy. We know the doxy actually helps with other things, such as at Harvard, they use it on sometimes cancer patients to prevent angiogenesis, which means the recruitment of new blood vessels. And so for our rosacea patients, it's working like that to prevent the recruitment of blood vessels at the meibomian gland that cause scar tissue. We love Restasis. And the problem with Restasis is you really do have to have a clear tear film. That's why it's number 6 on my sheet. We know that you need at least 3 months of Restasis twice a day for it to really kick in. It's the only FDA-approved drop that has been proven to decrease inflammation. It's essentially a diluted cyclosporin drop, so it's a real strong anti-inflammatory. My patients that love it really love it. My patients that hate it really hate it because it can cause sometimes burning. So we use steroid, a little small steroid drop called Lotemax or Alrex, twice a day or 3 times a day for the first 2 or 3 weeks to help you tolerate the Restasis until the Restasis starts to kick in. And then once it does, most patients really, really are happy with the Restasis in terms of how their eyes feel. If none of these are working or it's not enough, we then do something called a punctal plug. It's a temporary cover, or it can be permanent, over the drain that goes from the eye to the nose. We know that unless the tear film is really clear and clean, there's no excess bacteria and inflammatory factors, the punctal plugs will not work as well. That's why it's number 7. I don't give it right away because I want to make sure the tear film is really clean and keeping the good tears in. If none of these work, we go into number 8, which are the innovative ways of treating dry eye. This is not covered by insurance. The first one I like to try is called intraductal gland probing, where we literally put a cannula into each meibomian gland. Everyone has about 20 to 30 glands on the top and bottom, and we literally try to go in and make those glands work again. There's something called LipiFlow, which is the only FDA-approved device, which is essentially a machine that kind of tries to milk out this oil from the meibomian glands. And there's another thing called intense pulse light, which is not as researched, but some patients have had a good effect with that. If these don't work, we also recommend things like a personal humidifier that you can buy on Amazon around your neck or next to your bed or next to your workplace. We use a lot of autologous serum here at Visionary Ophthalmology that works very well in patients that need it. And what that is we take a sample of a patient's blood, spin it down, take out the serum, and create an artificial tear that the patient can use as often as needed for their dry eyes, and that works very well. The other treatments as well are sometimes needed, and we obviously try to treat patients early so they don't have to go up to the next tier of the step ladder. If you ever have any type of dry mouth or arthritis, make sure you let us know because we want to make sure you've been tested for something called Sjogren's syndrome. It's an inflammation in the body that can lead to dry eyes. I hope this little video has helped. If you have any questions, please feel free to email me, Dr. Dr. Kramers at visionaryeyedoctors.com. Thank you.